This one? Good morning, everybody. We're going to take our seats and get started soon.
Our panel is directly after you.
Yes, and I'm asking
Could you say that I'm going to say just a welcome word?
Yes, yeah.
And then I will
yes.
proceed with the panel.
Katrin said to me to ask you to come up and say a few words from a local perspective right at the end, before, so when they've all finished speaking, is that, yeah, that's right. Magda making opening remarks as a local representative. Is that okay?
Yeah.
Okay? Okay, cool.
And then the Polish panel.
And then you can lead into that.
Panelists will just go, and my panelists will.
Yeah, I mean, you could, I suppose, instead of getting everyone to get down, you could come up and say a few words, and then you can, then we'll all go off, shall we? Is that a good idea? Yeah. Okay. Whew. Could everybody take their seats now, please? That'd be great. Thank you. We're going to start in a moment. Okay. If the panel could come up and join me, that would be great. Oh, there we go. Would you like to come up? Oh, no, you're not. Oh, yeah. Katrin, do you want to get everyone up? We're not getting everybody up now? Or are we going to, they're not on the, they're not here. Okay, they're done. Okay, sorry, I didn't. Shall we? Yeah. Shall we ask? Do you want to go and round them up? Do you mind? Want to come up? Yeah. Have a seat. Whoever else, and you, Katrin.
Starting.
Yeah, which doesn't matter.
Doesn't matter.
Okay. Have a seat. I'll sit there. If you want to sit in the middle. Katrin, who else am I missing? Who are we missing?
President.
Is he going to come up?
Yeah.
And then that's good. Okay. Whew. Okay. Now, say hello. We didn't get to say hello.
Hello.
Hello, hello. Well, take a seat there. That would be great. And then we'll come to you. So, oh, Sorry. Very good. Good morning, everybody. Can you hear me at the back? Okay, thanks, Katrin. Welcome. Good morning, everybody, and welcome to the 6th European Harm Reduction Conference 2024. It's a real privilege to be here with you. My name is Tony Duffin. I'm the chair of the Advisory Committee of Correlation European Harm Reduction Network. As you're no doubt aware, Correlation are the organisers of this conference. Before I get into some further details, I just want to do some quick housekeeping. So the fire exits are well signposted and people should gather at the front of the building. Bathrooms are located, the ladies' bathroom is located to the right here and the men's is downstairs. Just to say to presenters, need to go to the speaker's corner, which is at reception, to double check and to upload their presentations if they need to. And when you are posting to social media, please use the hashtag EHRC2024. And also, if you could all wear your badges, that would be very helpful as people are networking and such. Site visits are booked at the registration desk, so if anyone's interested, please do go and do that. And then, importantly, we are filming and taking photographs as we throughout the conference, so please be aware that that is part of the conference. So that's... Pardon? Oh, and it's all being live streamed as well. Thank you, Katrin. This is all the planning bit. So look, that was the housekeeping for today. So once again, welcome to the 6th European Harm Reduction Conference. It is a huge privilege to be here in front of you, and there's lots of friends in the audience, and I'm sure lots of friends to be made here today. The theme of this conference is putting people first, empowering communities, and driving innovation. As we begin our conference, I want to start at the end. So please, if you haven't already, think about what you want to get out of this gathering. Is it the chance to connect with others, to deepen your knowledge, or to strengthen your skills? Whatever it is, keep in mind over the next few days and make it happen. As you know, there'll be workshops and talks and lots of networking and such, so there's plenty to get out of the next few days. The conference isn't simply about listening to speakers or attending sessions. It's about leaving here with a renewed sense of agency. It's about feeling empowered by the knowledge you've gained, the skills you've built, and the connections you've made. By coming together, we strengthen our collective ability to advocate for change and implement solutions that work locally, nationally, or internationally. Harm reduction is about creating opportunities. It is about taking evidence-based, compassionate approaches and turning them into practical change. We all know the challenges like stigma, criminalization, underfunding, and more besides. And as I was thinking coming in this morning, I was thinking about the 20th anniversary of the Correlation Network, which we're celebrating at this conference too, and how Katrin and Eberhard have navigated a global downturn in the early days, an economic crash globally, and then of course a pandemic when in fact harm reduction was very important too, but not to it's very important to acknowledge the devastating wars that are going on in Ukraine and Palestine. And for my part, I just want to acknowledge the 36 delegates from Ukraine who are here today. It's great to have you all here. So over the next few days, you'll hear from incredible speakers, people with living and lived experience, practitioners, policymakers, and researchers. Each brings a unique perspective, and together they represent the depth and diversity of harm reduction across Europe. As I said, for my part, I hope that by the time you leave, you feel a renewed sense of agency, that having attended, engaged, and communed with others, you leave you leave with confidence and determination to make a real difference, whether it's in your organization, your community, or your country. Before we get started, I'd like to thank people and organizations who've worked so hard to make this conference possible, from Correlation European Harm Reduction Network team, Katrin Schiffer, Leah Cushman, Stephanie Cole, and our local partners, Magdalena Bartnik and Kwasniewski, and many more besides. Your efforts and dedication have created this space for us to connect, learn, and grow. So as we kick off, think about the end. what will success look like for you when you leave here? Set your goals, make connections, and seize the opportunity. Thank you for being here, and let's make this conference count. So, for our opening session, it is my pleasure and privilege to introduce our speakers, and we're very grateful to all of them for being here today. We have former President of Poland and Global Drug Policy Commissioner Aleksander Kwasniewski, Vice Mayor of Warsaw, Aldona Magdalena, and we have Chair of Euroinput, Daphne Chronopoulou, and Katrin, Schiffer, the Director of Correlation European Harm Reduction Network. So I will invite our former President of Poland to address the group. Thank you. There we go.
Thank you. Thank you. Ladies and gentlemen, dear friends, welcome to Warsaw. Welcome in this very special place, because you are in the palace, which is to some extent the symbol of the past, of Polish past, of the period of communism in Poland. This building was a gift of famous person, I guess Joseph Stalin, who decided in the 50s to offer such gesture to Poland, to Warsaw. But I would like to welcome you in modern Poland. This year we celebrate very important anniversaries for my country, 25 years of our membership to NATO, North Atlantic Alliance, and 20 years of our membership into European Union. And I think the next important symbol of a new era of Poland is that if you will have a time, I propose to you to go really 100 meters from this place to new opened Museum of Modern Art. And you will see really interesting architecture, and especially very interesting exhibition of Polish modern art, which is really 100 meters from here. The beginning of this building was very successful because created a lot of controversies. And you know, it's nothing better for new museum as to create such controversies. And really, that is something what I suggest to see if you will have the short break even here during the conference. I would like to welcome the participants of the conference, scientists, practitioners, policymakers, lawmakers, all of you, because I think only together, only if we will cooperate together, we can achieve some positive results, some goals. And that is good that you are here. That is a lot of people, and I see that the age average is good. You are much younger as I am. That's fantastic. It's quite easy, frankly speaking, but this is good. And I wish you a good stay in Warsaw and good conference. I would like to tell you also about my road to these activities, because it was not so obvious. I was a president of Poland in the years 95, 2005, 10 years, 2 terms. That is in Poland maximum. According to our constitution, we can be only twice elected, so that was very, very important 10 years, because it was time of our fight to be members of European Union, of NATO, of new constitution, etc. But frankly speaking, during this period, we were very much involved in this very tough concepts to eliminate, in sense of drug policy, to eliminate drugs, etc. It was close to this idea, which was very well known from the United States, from 70s, zero tolerance, etc. And I signed as a president. Of course, it was not my initiative, but according to the constitutional rules, the president is this last person signing the new bills. So I signed a lot of very restricted restrictive bills about drug policy. And when I finished my presidential terms, I observed that the results of this very tough policy are very limited, and even this policy I can describe as a counterproductive. And the people from Global Commission on Drug Policy came to me one day, surprisingly, and they proposed to me to join this group. And I said, look, maybe I'm not the best candidate because I signed such bills, and they told me, no, you are a good candidate because of that, because you understand the mistake, you understand the problem. And I decided to join this group, and I'm quite many years the commissioner in the Global Commission. And for me it was very interesting and important. Then I met, among other colleagues, also the presidents of especially Latin America's countries with the same road, with the same experiences. Also, they started as a tough fighters against drugs, and finally realized that that is a wrong approach. And in this commission, I'm with such colleagues like former president of Mexico, Zedillo, or former presidents of Brazil, Chile, other countries. And I met also the man who I want to introduce now, and I ask you for applause, the best specialist of these problems in the world, Professor Michel Kazachkin. Michel, welcome, and applause please for him. You know, in each team it's good to have some activist and one serious brain, and he's our brain. You know, that's good. That is very good. And because we continue this activities, and also we understood that it's very difficult if you want to prepare good drug policy and especially harm reduction policy, and especially decriminalization. It's very difficult to put all countries or all regions in the same basket, because the experiences, the background, the tradition, the understanding is very, very different. So the first regional group was created, I guess, in Africa by Kofi Annan. The next was in Latin America with very specific problems. And we decided here in Central and Eastern Europe and Central Asia to establish such regional group. And we did it. The beginning was very difficult because we started during COVID period. It was not easy, but finally we have this group, and we invited politicians, activists, experts to our group as well. And one of our regional commissioner is with us, and I would like to introduce him as well, Vytenis Andriukaitis from Lithuania, and the member of European Parliament. He will participate in one of the panels during the day, and I think now he's our influence inside European Parliament, what is important element for our next actions. We visited some of countries of the region: Kyrgyzstan, Kazakhstan, Lithuania, Ukraine. We want to visit and to help to solve the problems in the region, because, as you know, this region is, in sense of our job, harm reduction, is very difficult. We have a high numbers of the indicators are very high for many elements, and politically the situation in the region is extremely complicated, because inside this region of Central Eastern Europe and Central Asia we have Russia. And as you know, Russia is very much against all these, let's say, liberal methods. They are still very they have a very tough politics against drugs, drug consumers, etc. And they try to export this concept to the region. And in some countries, this influence, this Russian influence, is very visible, and that is a problem how to overcome through non-governmental organization or some normally opposition people these problems. So we try to do something in a very concrete way, not only speaking, not only discussing the necessity of harm reduction policy, but by even small steps. I give you example. During our last visits in Kazakhstan, even we met the President Tokayev, what was very unexpected and a great honor for our group. We try to explain this methadone policy is necessary to continue, because Ministry of Interior is absolutely against. They try to explain to the President that methadone is also the drug, and that is a continuity of using drugs, etc. And of course, this discussion with the President was not easy, because Minister of Interior was next to him. And but we explained our position, the position of World Health Organization, and all international experiences in this case. And last weeks we received the information from Astana, from Kazakhstan, that finally they imported the necessary amount of methadone, and they will continue these procedures with the patients who needed the methadone. So, of course, that is not a revolution, that is not a real change of the policy, but that is a step forward, helping the people. What I count as a real success, as a real and yeah. Thank you. So, and finally, because you will have a lot of discussions, and I don't want to repeat all this well-known, especially among us, the arguments why this drug policy should be different, should be much more liberal, should understand first that we have a lot of evidence, scientifically based evidence, which is necessary to use. We cannot repeat all these stereotypes which are existent in the public sphere. That is the first. The second, we know very well in many countries, and especially United States is the best example, that this tough policy is the road to nothing, to nowhere. Because we have an increasing number of the people in the prisons. We have still the increasing problem of drug consumption, etc. So it's necessary to change this approach. But of course, to do it is difficult, and that is something what me as a politician or ex-politician I see as a crucial point for our success. We have to change the thinking of the public opinion. We have to explain by the arguments, by the examples, that this is necessary to have a new approach. Decriminalization, harm reduction, support, better healthcare system, better system for to help the consumers. All these elements which are known, they are not used fully in one country, but in many countries we can find a lot of positive examples. We have to change the understanding of the people in our countries, because without this change of thinking of public opinion, we'll have difficulties to have a better members of the parliament who will understand that it's necessary to change the law. Without this very conservative, traditional thinking of public opinion, we'll have not the chances to find more money, more funds for the healthcare system, for support, for harm reduction, for support for the people. So without this public debate, without the very active discussion from our side, will have no chances to change this thinking of policymakers, and especially leaders of the countries, because they are very much afraid. That is a problem. How to win the election if I will say that my thinking about drug consumers is so liberal. And I tell you that the last elections in many countries in Europe, and especially in the United States, they showed us that the problem is serious. That it's not so that progressive thinking is increasing. No, the conservative thinking is increasing. And sometimes this conservative thinking is the worst kind of conservatism, because all of us, to some extent, we are conservatives. But this very, very primitive, vulgar conservatism is a real danger of the world today. And that is why your conference is so important, and especially your presence is so important, and your actions every day, your type of thinking, your arguments, your engagement, your determination is so important for all of us. And finally, I want to suggest to look for the newest report of Global Commission on Drug Policy, that is Beyond Punishment, from Criminal Justice Responses to Drug Policy Reform. It's really well prepared, good, with a lot of strong arguments which we should use in our everyday work. So thank you very much. Again, welcome to Warsaw, and I wish you a good conference, and I hope that my speech was not the worst beginning of this conference. Thank you very much.
Thank you, President Kwasniewski. Now I'd like to invite Vice Mayor Aldona Maknowska-Góra to address the delegates. Thank you.
Thank you. Ladies and gentlemen, distinguished guests, dear colleagues, welcome to Warsaw. Mr. President said everything I wanted to say about the city, this building and new Museum of Modern Art, so I just can say, be sure in Warsaw is a lot of beautiful, wonderful places to spend your time. I hope you will be able to have a free time in Warsaw to see our city. But as a modern open metropolis, Warsaw is adopting an approach based on solidarity, science and empathy, which is at the heart of the idea of harm reduction. We believe that caring for the health and dignity of every human being is our shared responsibility. We believe that every life is precious and deserves to be supported and protected. This is why Warsaw is actively involved in activities aimed at minimizing the negative effects associated with the use of psychoactive substances. We work, of course, with NGOs, public health institutions and local communities to provide comprehensive support and assistance. Our aim is not only to reduce health-related harm, but also to counteract the stigmatization and social exclusion of people struggling with addictions. The actions we take in Warsaw to support the idea of harm reduction, it's drop-in day care centers, where inpatients activities are carried out. The offer is aimed at addicts from all over the city. Mobile harm reduction service is a project that has been running since 2017. It assumes a broad offer of running and health and social harm reduction program among people using harmful substances and people addicted to psychoactive substances. Also, of course, street workers activities. They are carried out in the client's living environment. Support for people in homelessness and addiction crisis. The city operates and co-finances shelters and facilities that offer comprehensive support. Of course, what is very, very important, education and prevention. We implement prevention programs to raise awareness of the risk associated with the use of psychoactive substances. We organize workshops, information meetings, and community campaigns to help residents make informed and responsibility decisions. Information activities. The city undertakes a range of information activities to build residents' knowledge and awareness of the risk of substances abuse and to promote safe and responsible choices. Harm reduction is not only about interventions. It's also about building space for dignity, acceptance and health for everyone. As a city, we want to be an example of how to act effectively and with empathy for the most vulnerable social groups. Thanks to your commitments and the exchange of experience at this conference, we have the opportunity to develop new and effective strategies and solutions that will improve the quality of life for many people. I believe that together we can make significant progress in this area and create a more human approach to addiction. I wish you a really good conference, a good time in Warsaw. Thank you very much.
Thank you so much. And now, the chair of Euro Input, Daphne Chronopoulou. Up you come.
Thank you, Alexi. Dzień dobry. Good morning. I'm Mr. President, Madam Vice Mayoress, we have the honor to have here a member of the European Parliament and many eminent professors, as well as our community of harm reduction people, friends and co-workers in this amazing field. I am the chairwoman of Euroinput, the European network of people who use drugs. And I am very happy to be here. Personally, I love this Soviet building. I believe we should always embrace our past, and Warsaw and Poland is a place with a very rich past. From industrial revolutions to so resistance to this thing we're living today, which is amazing. As a junkie, as a woman who uses drugs, I owe my life to harm reduction. I wouldn't be here among you representing my peers, the people who use or use drugs. And I owe my life to this kind of liberal thinking. So we say in our community, nothing for us or about us without us. And this is why I want to say I'm very grateful that I'm invited here representing my community. Thank you, and I wish us a very interesting and enriching conference. How do you say? Dziękuję bardzo.
Thank you so much. Thank you, Daphne. So, thank you to our distinguished guests who have spoken so far. Thank you so much. Now I'm going to introduce you to someone who I work closely with, who is an inspiration, I think, to our sector, Katrin Schiffer, the Director of Correlation European Harm Reduction Network.
Dzień dobry. I think if this is such a success, I say it as well. Dzień dobry, and welcome to Warsaw. Yeah, I'm extremely excited. I'm extremely nervous, and I'm so happy to see all of you. I represent Correlation European Harm Reduction Network. At the same time, I'm also the head of the international department of the Regenbooggroep in Amsterdam, which is the low threshold harm reduction service in Amsterdam, and I'm happy to say that we have quite some colleagues from Amsterdam here as well from our organization. So, organizing this conference has been quite a journey. Sometimes we compared it in the team to hatch a dragon egg. You know, we were nervous, we were curious, we were excited, we didn't know what comes out. There were uncertainties and doubts, many challenges. And sometimes we worried that what if instead of a sweet, tiny, sweet little cute dragon, we unleash something which we cannot handle. But if I see here, I'm standing here and I'm seeing all of you, colleagues, friends, many of you I know, I'm so overwhelmed with positive feelings and emotions, so I'm really happy. Our conference theme is putting people first, empowering communities, and driving innovation. And for us, this is not only a slogan, it is exactly what Correlation stands for. We promote an inclusive harm reduction approach which builds on evidence, practical experience, and lived and living experience. And I think the whole program committee with whom we organized and prepared the conference, we had not only the European Network of People Who Use Drugs, but all kind of organizations which provided really very valuable input, and I hope you will see that as well in the whole program outline. However, while we gather here to celebrate and share our knowledge, I also feel the need to share concerns. Harm reduction in Europe and globally is under pressure. And despite overwhelming evidence that harm reduction works, services remain underfunded. And in many countries, basic harm reduction services are not even available. People who use drugs continue to be among one of the most stigmatized and discriminated groups, often denied access to health and social services. Several organizations in Europe, including Correlation, but also Foundation Mainline and many others, are currently facing severe budget cuts. This trend is alarming and does not stand on itself. I'm concerned, but most of all, I'm getting really angry. And I know many of you are getting angry as well. Because after years of friendly and diplomatic advocacy, talking to policy and decision makers, we feel that we probably need a different approach, more assertive, more direct, I wouldn't say more aggressive, but probably more effective. Because we are tired to being asked what we already know. Harm reduction is grounded on human rights, it's grounded on evidence, harm reduction works, harm reduction saves lives, and it is cost effective. And in principle, harm reduction is the best thing you can get. Existing evidence is often ignored, so there is evidence, we all know that, and countries fail to scale up services. Instead, policies are still driven by ideology, questionable morals, and very often political, cowardly behaviors and statements. Research on promising and innovative harm reduction interventions remains underfunded, and instead of that, millions of euros are funneled into prohibition, repression, and criminalization, even though we know the devastating effects of these policies costing the life of millions of people. I feel that we must act now and push for change, push back the rise of extreme right and populist governments, scapegoating those who don't fit their narrow definition of what is normal. This includes migrants, LGBTQI communities, sex workers, people experiencing homelessness, and people who use drugs. We need to push EU member states to implement the EU drug strategy to which they all signed up and implement it in a balanced way. And we need to demand that the European Commission, particularly DG Sante, responsible for health, establish finally and for the first time a dedicated funding mechanism for harm reduction and a health-based drug policy approach. And it's great to see that we have so many people and also a member of the European Parliament, and I think this is a good moment to say that we would also like to reach out to the members of the European Parliament to get support in this. So, much more to say about this, but now I go to the more brighter sides of this conference. Some facts. We are here today and tomorrow and the day after with 500 participants, and this is the biggest number of participants ever for the European Harm Reduction Conference. This is amazing. We have a total of 48 countries represented. And over the course of the conference, you will be able to join 50 sessions. No, you cannot join, you need to choose from 50 sessions. You can listen to 130 speakers during plenaries, parallel sessions, workshops, networking zones, poster presentations, artistic performances, and all during breaks and also during our conference party, which will be organized tomorrow evening. It's on the right or on the left side of the building. You will find it in your program booklet. And it's not only to celebrate the conference, but as Tony already said, we are in the happy position to celebrate our 20th anniversary of Correlation. This is really an amazing moment. We would never have thought about this. And all of you should have received, while you registered, a wonderful booklet, which has been compiled by my dear colleague Eberhard Schatz, my colleague for 20 years. You will find all kinds of timelines, events, and also beautiful interviews with beautiful colleagues. And for me and my colleagues, it was quite an emotional moment to read this book, and because it really reflects what we have been doing throughout the last 20 years. So I hope all of you will be coming to our conference party tomorrow, which starts at 8 o'clock. I also want to express my deepest gratitude to the conference team. Lea, Steph, Eberhard, Rafaela, Hannah, Joanna, and the rest of the Correlation team, as well as our local partners, Magda from Precursor and Kasia from the Global Public Health Network, and the fantastic team of volunteers. They have worked their socks off in the last months, but especially weeks and days, and I think they really did a great job. I also want to thank the program committee who contributed to the overall outline of this conference, and to all our partners and supporters. This includes in particular the City of Warsaw, who supported us generously with providing this fantastic venue. So thank you very much for this. Thanks as well to the City of Amsterdam, which will organize a satellite event on Wednesday afternoon, to which you are all invited. The European Commission for the funding we receive still, Gilead, and not at last, the EU Drug Agency, who also supported us. And last not least, our host organization, the Regenboog Group, which has supported us for over the last 20 years, which is not something we take for granted, because I think this is amazing, and they support us with financial backing, technical assistance, practical advice, and they have always been there for us, so it's really great that they are here. Last sentence. Let's use the next few days to have fun, connect, learn, and inspire each other. And I thank you all for being here and welcome you to the conference.
So, thanks very much. I've had my eye to the time. I'll invite you up in a moment, Magda. Just a second. Just to thank the panel again, dignitaries, for joining us and saying those kind words. But that's it. Thank you very much. Round of applause. Thank you. That's great. Thank you so much. Wonderful. Now, I did miss out something on the housekeeping. I apologize. There's an app, and I'd like everybody to use the app because it's very good and everything is working on it. But there's a leaderboard, and where's Wes? Wes, could you stand up, please? There's no money, no cash prize, but Wes is the head of the lead of the golden standard. So you want to be Wes, you want to be using the app. So congratulations, Wes. Now I'd like to invite Magda Bartnik up to say a few words from the local representative's perspective before the next session. Thank you. Thanks.
It's so good to see you all. A great crowd of people fighting for the right cause, human rights, human dignity and freedom, standing together against violence towards people who use drugs and against devastating drug laws and policies. It's such an empowering moment to have you all here. Welcome to Warsaw. Cold and grey, an architectural patchwork, a fascinating city that suffered occupation and massacres and was reduced to rubble. And like Phoenix, has risen repeatedly from the ashes of war. Its indestructibility makes it unique. Warsaw is reinventing itself again and again, open to all that may come, open, free and dynamic. Welcome to the Palace of Culture and Science, a symbol of oppressive totalitarian regime and a real-life embodiment of Soviet domination, and at the same time, a reminder of the country's struggle for independence and a testament to the indomitable spirit of its people. And for the next 3 days, this is where the heart of the city will beat, in these monumental halls, with harm reduction so often rejected or on the margins as a guiding force. A celebration of humanity, solidarity, kindness and life. Thank you. I would like to invite you now to the Polish panel. We'll introduce shortly our panelists, and then we'll pose one question to each participant, because we don't have much time. So we have Agnieszka Sieniawska, a lawyer. She's leading Polish Drug Policy Network. Jakub Gessler-Nowak from Social Initiative for Narcopolitics, Zofia Kotańska, human rights activist and harm reduction worker, Kasia Urbaniak, community and harm reduction activist, and Justyna Struzik, assistant professor at the Jagiellonian University. We want to talk about drug policy in Poland and the situation of people who use drugs. I'm really happy that we have young, committed people as our panelists, understanding more than previous generation of experts combined. And I will start with you, Agnieszka, about drug law reform. You've been working in the field for many, many years now. Where are we now? How would you assess the current situation?
O, jest, działa. Dobra, dzięki. Hello, thank you, Magda, for the invitation and all the organizers to the invitation to this panel. And let me walk you through the legal landscape of the drug possession in Poland. As Mr. President said, before 2000, possession of small quantity, even for personal use, wasn't punishable. But situation has completely changed in 2000 by introducing Article 62 of Act on Countering Drug Addiction, which penalized drug possession. Due to this fact, everybody, for example, who is on this room, and everybody in Poland can be stopped by a police officer on the street and searched. And if possess small amounts of drugs, even for personal use, even in small quantity, can face up to 3 years, 3 years of imprisonment. If possess larger amount of drugs, it can face up to 10 years of imprisonment. In minor cases of possession, so less serious cases of possession is punished by up to 1 year of imprisonment, community service centers, or a fine. But in most frequently, prosecutors decided to use the first option. Even if somebody possesses, let's say, 1 joint of marijuana, they use the first option from the Article 62.1, Act of Counteracting Drug Addiction, so punishment up to 3 years of imprisonment. But it's worth to mention that in many cases the sentences is suspended for 1 or 2 years by judges. Appearing this article in practice creates a new crime connected with drug possession, almost in small quantities, and a profile of drug offender which is dominated by young people, possess very small quantities, mostly marijuana, and individuals who are struggling with dependence on drugs. That's why in 2011 a very shy, a little drug reform was implemented in Poland, which allows prosecutors to stop the proceedings and discontinue cases in minor possession. So when somebody possesses a small amount of drugs for personal use. But still, unfortunately, this is not used by law enforcement authorities in their daily work. And after this little change of drug law in Poland, drug possession offenses now dominate drug-related crime. Can you imagine that 73% of all detected drug offenses in Poland in 2020 was connected with drug possession? 73%, yes, 73%. Moreover, even if some cases are dismissed or prosecutors decided to discontinue legal proceedings, police officers take care to bring the new one. So that's why the growing statistics of arrests undermine the reform's intent. In 2020, we prepared research and we asked prosecutors why they don't want to use this new tool. And the research shows that 70% of prosecutors rarely or never dismiss cases connected with drug possession, even in small quantities. And this is because they struggle with defining what small quantities of drug is. Nobody knows. Prosecutors don't know, judges don't know, police officers don't know what small amount quantities is. That's why Polish judges stated that threshold table for drug quantities would help them to define whenever the case is suitable to discontinue or not. So, on the other hand, we have very restrictive Polish drug law and it has a harsh implementation. On the other hand, it's worth to mention that a few years ago there was breaking change in Polish drug law because very conservative right-wing party called Law and Justice Party decided to legalize medical marijuana. So you can buy it in Polish pharmacies, and it's quite available because of medical purposes. So in this country, nothing is predictable. On the other hand, left-wing party and left-wing party president could criminalize drug possession. On the other hand, right-wing party could legalize medical marijuana in Poland. So that's why we still have hope and for drug decriminalization in small possession in Poland, and this remains our main goal which we fight for. Thank you for your attention.
Thanks, Agnieszka. Jakub, coming to you now. You've been working in nightlife setting and party harm reduction. How would you describe that? What are the circumstances and the reality of that also work?
Okay, I'm a party worker in social initiative for narcopolitics, and our organization focuses on working in electronic music parties in clubs in 5 big cities in Poland. And this is Warsaw, Poznań, Tri-City on Polish coast, Łódź and Katowice. There is also an initiative with party working in Krakow, but that's it. In Poland, we don't have opportunity to make party workings in small towns and clubs in rural area. 100 kilometers from here to east, there is a village called Nurt. There is a club called Nevada, and this is the biggest Mazovia dance music club in rural spaces, and we don't have any opportunity to go there with our party working services. And this creates a gap between methods of harm reduction in clubs in big cities than rural area. So our first problem with party working services in Poland is a gap between opportunity to gain knowledge from users in big cities, organized parties open to harm reduction, and a lot of parties without these methods. And our spaces are aimed to make feel safe, non-judgmental, and welcoming for all attendants. We have volunteers who educate, make trip sitting and first aid. So we also give leaflets with major grabs of substances knowledge and things that help in safe use of party narcotics. Clean snorting tubes, disinfect wipes, joint filter with active carbon, things like this. And we also work on fetish parties with bigger risk of harm connected with sexual activities. So we give condoms and lubricants, and we also provide services of giving knowledge connected with sex education. And the biggest challenge in Polish narcopolitics is tabuization of drug use. In 2010, there was a huge explosion of designer drugs called by Polish press dopalacze, which means enhancers. And in 2018, this enhancers was delegalized. But these 8 years of market war between Polish lawmakers and a market of designer drugs made a gigantic flood of new stimulants on the market, on the black market. So our biggest issue in clubs is that we don't know which substance people use. They use a lot of different synthetic stimulants, which even they don't know what they are. They are called crystal, and nobody thinks what the crystal is. So we don't have knowledge to give harm reduction advices to reduct harm of substances that we don't know. So one tabuization and fear reaction of Donald Tusk government in 2010 made a very dangerous situation on club scene, black market now. I have to end my speech, but one more thing that I want to discuss is that very big problem with party working in Poland is the financial challenges. Because as a social initiative for necropolitics, we are charging 70 euros for our materials from organizers of the party. And for many organizers, this is too much. And I don't think this is too much, but they think that this is unnecessary cost. And we are all, often ghosted by the organizers of the parties because of this fee. And sometimes we have grants and we can give our services for free. But it's always making the question if we should teach the organizers of the party that safety on in club is free. So challenges with financing and this unwelcoming, financially unwelcoming attitude of party organizers is last issue I want to tell. And thank you for your attention, and have a nice conference. And I also welcome you in Warsaw. I like Warsaw, it's a great city. So have fun.
Yes, Zosia, one question to you. What changes on the national and city policies would impact the protection of the rights of people who use drugs?
I'm going to answer the question and start with the beginning of the human rights in harm reduction, because as it was mentioned before, harm reduction is really grounded in the human rights. And it's not only the health strategy, but above all an approach rooted in respect for human dignity and protection of fundamental human rights. It supports the individual at the risk of exclusion, stigmatization and harm. It is a practical application of the human rights for people in the public health and social policies. And I would like to go through some of the Polish national and Warsaw policies that I think support the human rights violations. So there are the national policies, as was mentioned before. There we have a very repressive drug policy that is treating users as criminals. So it reinforces their marginalization and social exclusion. It provides severe penalties, including imprisonment for possession, even small amount of drugs. Arrest for possession lead to very brutal treatment from the police that goes with a further exclusion. So, yeah, of course, one of the biggest issues for the harm reduction in Poland is underfunding. I think we are struggling with the same problem. But I would like to mention that in Poland, NGOs are filling the gap in the public health system by offering the key harm reduction services that are not implemented by the state institution in a sufficient scale. And the NGOs play the key role in implementing the programs. We have huge administration requirements and very limited funding. What is one of the biggest issue in the national Polish policies is we are lacking a long-term reintegration strategy. So we are based on short-term grants, and social and professional reintegration is crucial for permanently overcoming addiction. But there are many gaps in the support system in Poland. we have a lack of the coherent strategy on the national level and lack of the long-term strategy for the social and professional reintegration. I would like to welcome you in Warsaw. It's the city that I work in, and it's Warsaw as the largest city in Poland and the capital. There is many harm reduction organizations that cooperate with the city authorities. And I'm working in a Precursor Foundation that runs an integrated harm reduction center with a drop-in place in the city center, where people have access to like a washing machine, shower, hot meals. We run the needle and syringes exchange point. We run the street working. We have the mobile harm reduction center. And I would like to tell you more about the district, the Praga Północ, which has the largest number of psychoactive substance users. There are the free substitution therapy points at this district, and harm reduction activities are carried out. There is the outreach, street works, and the mobile harm reduction center. And this district struggles with many problems, such as gentrification, homelessness, violence, discrimination. And as a street worker working there, I would like to invite you for a walk in this district, so I can tell you more about the problems that the users in Warsaw are struggling with. The walk will start at 2 p.m. and you can register. Sorry, I'm being a bit stressed. And I would like to tell you more about the Warsaw's policies. So, in short, I think we are really lacking the center that will get all the NGOs together, placed in the Praga Północ district, because we have a lot of organizations that are scattered, and it really makes it difficult for the users to find one city, one center that could use. And we are lacking the coordination between institutions. And that's, for me, one of the biggest issues in Warsaw. With the start of the war in Ukraine, we started to have more migrants coming to Warsaw, and there is it's a lack of a strategy for the migrants and the people without the documents to bring the help. So this is what I would like to point out. There is no policy for the people like this, and it's all on the hands on the NGOs that could provide them a help. So this is a big barrier in bringing the help in Warsaw. What I wanted to say is migrants addicted to psychoactive substances might be double stigmatized because of their origin and addiction. But this is to do with the legal instability, and we really do need a new policy for the people without the documents and the migrants. And what is crucial in the Warsaw policies is the housing crisis that we are facing. We have a huge housing crisis in Warsaw. We have a very limited amount of social housing units and assistant housing. We have some programs, but it's not enough. And in the end, I would like to mention that in Warsaw, in 2022, we have 9,607 vacant municipal premises, like empty housing, that could be used for the people, but they were not used. We have a lot of empty housing and very little of the supporting houses and the social housing. And for your question, just a few solutions that I come up with for the national and Warsaw policies for the people who use drugs. And that will be, really we have to develop a long-term reintegration strategies. it is crucial to make the process go to be continuously, yeah, and of course it's very necessary to increase the funding for harm reduction programs because we cannot base on short grants every year, and we are really underfunded, I think, is the case for all the European harm reduction organizations. And we really do need to, we have the biggest amount of users in Warsaw, scattered in one place, in Praga Północ, and we do need to open one harm reduction center that would unite all of the scattered organizations. This is one of the most important things. And we have to increase the supply of a social and supported housing and develop the housing first program. Thank you.
Thank you, Zosia. And now, Kasia, could you tell me what it's like to be a person who uses drugs living in Poland?
So I would try to speak as short as possible, but I think that two main issues that we as people who use drugs in Poland face are the state violence or the criminalization of the street level activities like drug possession, drug sharing, or even the small scale distribution. And the second one is the forced abstinence ideology. As you all have spoken about the state violence, I will try to focus on the latter. So, because the forced abstinence, in my opinion and in my experience, can be sometimes just as much harmful. Although this may not be a problem for most of the people who use drugs in Poland, those who have no problematic relationships with the substances they use, they need to worry about the criminalization, though. However, for the minority of people who, for any reason, have developed a problematic relationships with the drugs they use, and they decide to seek help because of it, well, they may expect to experience, at least to some degree, shaming, stigma, or even trauma from those who are supposed to be of help. At some point, it's almost sure that they will be forced or shamed to comply with the rule of the abstinence, that is. In Poland, the harm reduction services are few and mostly located in some of the biggest cities. And most of those that exist do a terrific job, despite how underfunded or neglected by the government they may be. But one needs a lot of luck or privilege, or sometimes both, to access them. And however, most or all of the employees are really fantastic, dedicated people, you can only do so much. So, most importantly, the harm reduction services in Poland cannot provide some of the crucial and honestly widely available in the other European countries services, like the supervised consumption site or drug checking. Those two are illegal under Polish law. Even the official or legal naloxone distribution seems to be impossible to establish for some reason. There are also very few peer workers working in the field, and in my view, that's a shame. What is more, many of the so-called harm reduction services and the OAT services serve as the best or the worst example, have absolutely nothing to do with the philosophy of harm reduction. They are founded of the most dehumanizing, stigmatizing principle so you can imagine. So there is stigma, there is extreme paternalism, there is surveillance, and there is no real place for the patient's self-determination. So, I would like to see more of harm reduction and people who use drugs activism or advocacy in Poland. But for all the reasons I mentioned, and many others I didn't because of the lack of time, I feel that there is a little room for that. But I believe that there might and there is some. Because I do believe in the community mobilization. And I got to know some of the most caring, bold individuals among the people who use drugs in Poland. So I am so happy to see many of you here at this conference, and I believe this event might, may, and will help us. Well, thank you.
Okay, and last question, this panel to you, Justyna. Why do we lack research engaging people who use drugs and being conducted with people who use drugs?
Yes, thank you. I mean, I have my answer written here, but I think that responding to the call of being more direct from the previous panel in our demands, I will just say something and I will not read what I wrote here. I really want to invite you to the exhibition that is happening here on your right as we are sitting here. Exhibition of an artist, Paweł Sowa Florian Krynicki, who died 1 month ago. And because we are in Warsaw and he loved Warsaw and he loved the palace in which we are, I want to say that he died because he was denied healthcare in Hospital Wolski here in Warsaw. So this is the reality of people who use drugs in this country. What is more, a few days before Paweł died, I sent him a package with naloxone. This is what people do in Poland since naloxone is not accessible. Some people bring naloxone from the abroad and then we distribute it among people who use drugs. Paweł never managed to pick up the package because he already passed away. I really want you to go to the exhibition and see how Paweł perceived
his city, Warsaw, and also Praga Północ that was mentioned in here. Paweł was involved in a research project, a huge European research project in which I was also involved, navigating citizenship through European landscape of criminalization. In this project, we looked at criminalization in different European democratic countries, and we explore how criminalization is actually used to govern society, contemporary society. We can see it criminalization of protest, criminalization of abortion. My part was criminalization of drug use. And within this project, Paweł, that I already mentioned, he was responsible for creating an ethnographic novel based on stories of people who use drugs in Poland. And part of this comic book you can see in the exhibition. Maybe just to end, I will give you a few, very few recommendations coming from my research, since my colleagues perfectly explain the reality of Poland. But if you are interested, you can see more in this policy brief that will be there in the hall. So first of all, sorry, too many pages. First of all, support grassroots efforts, support the communities of people who use drugs directly. Second, expand and diversify harm reduction programs. Kasia mentioned that we have very few harm reduction services, only in 3 cities in Poland, that's it. Ensure the widespread distribution of naloxone. Naloxone is not accessible in Poland, once again, is not accessible. Transform medical education. Why? Because the stigmatization coming from medical professionals towards drug users is unbelievable. We need to change medical curricula. We need to introduce human rights into future doctors' curricula. Recenter research and social actions on drug users. This is partially answer to your question. I mean, focus on involve people who use drugs directly. And the last point that I want to say, tailor harm reduction programs for young generation of people who use drugs, because it seems that we don't have that much access to this group, especially for opioid users. Thank you so much. Sorry, this was not the answer, but I just decided to speak directly.
Yeah, thanks. Thank you very much. I encourage you to see the exhibition. I encourage you to have a walk if there are still free places with Zosia, walking tour in Praga. And now I will ask Kasia Kowalczyk from the Global Public Health Network. She won't talk about public health, but give you a couple of logistical information, super important ones.
So, hi and welcome. And my few words are totally unrelated to what we heard in panel. They're just fairly practical, because we are about to have a coffee break, and it would be nice if you